If you have ever wondered, can I drug test my child at home or how to drug test my child, you're in the right place. Today, we are going to be walking through how to administer a drug test at home. Hi, my name is Lindsay Behrens, and I'm the Substance Use Recovery Manager for Evolve Adolescent Behavioral Health. Before you start drug testing your teen at home, come up with a few agreements on what that is going to look like. So ideally, you and your teen will discuss frequency of testing. So will you be administering one random test a week or 2 random tests a week? Also, how are you going to talk about results? Have both people agree to use honest and non-judgmental language, really focusing on support and problem solving rather than blame. What if a test result is positive? Agree upon appropriate consequences that will be implemented if there is a positive result. So this might look like a loss of privileges, such as limited access to certain electronics or not being able to see friends, but it also might look like an increase in other things, such as drug testing or attendance at community meetings. Lastly, agree that them refusing to take the test at the agreed upon time or the agreed upon frequency gives the impression that some type of recent use has occurred. Make sure that when you are choosing a drug screen at home, that you want to choose a panel that reflects what you need tested. So if your child struggles with amphetamine use, for example, you want to make sure that the test will test for amphetamines. Same with something like fentanyl. You want to make sure that the test that you choose, whichever type, reflects that in its testing for that. So what I have here is a 12-panel test. What this means is that there are 12 substances being tested for. I also have a 5-panel test here, which you might notice looks a little bit different. So with the cup test, the testing strips are inside of the cup. And with something like this, what you would do is you would remove the cap and you would actually dip the testing strips into the sample. You would want to hold it there for a couple of seconds. What you're looking for is to see the liquid creep up here into the testing boxes. Once it does that, you would go ahead and close this up, put it to the side until it's ready to be read. So a few additional things to be aware of. Certain substances will not typically show up on a standard panel test. So things like alcohol or shrooms or even fentanyl won't be found on standard panel tests, even something like a 12 panel. So there are instances where maybe you do want to test for something that's not on the standard panel, and you can find individual test strips to test for specific substances. So perhaps you get a 5-panel test, but then you want to also get fentanyl test strips or alcohol test strips to make sure that you're getting a reading for that as well. Now, if alcohol is one of your main concerns for your child, a breathalyzer is going to be the recommended test for current intoxication. And the reason why that is because drug screens can only tell us if the substance is present within the system. So it cannot tell us current intoxication. And the thing is that typically a lot of substances really only remain in the system for about 2 to 3 days, sometimes a little bit longer, but on average, there's a pretty short window of time where it can be detected. And that's also why, especially in early recovery, we recommend testing approximately 2 times a week because, again, there is such a short window for certain substances. Now, the only substance where that does not necessarily apply is going to be with cannabis. And cannabis can be a really, really tricky one because it can remain in the system for an extended period of time. And how long it remains in the system varies on a lot of different factors. So, how much they used, not just how recently they used, but also, is this someone who uses sporadically, or is this someone who uses chronically over time and has been for a long period of time? So all of those things make a difference. So if you are concerned about cannabis use mainly, my recommendation would be to go to a lab in your area and ask for a THC levels test. The thing about a definitive test is that it's going to be able to give you a more accurate idea of how much THC is being found in the body. And that can give you a better idea of how long it might take before you see a negative result at home. Now, it's not going to be able to give you a specific time window, but typically, the higher the number, we would expect that to take a longer time to exit out of the system than a smaller number. So now let's look at some recommended steps for administering a test at home. The first thing that you're going to want to do is make sure to check your child's pockets. You also want to make sure that they're not bringing anything into the restroom with them, so no bags, purses, things like that. We also want to make sure they're not wearing a lot of really layered clothing, baggy clothing, things like that. And this is because we want to try and limit the potential of them bringing something into the bathroom with them. The next thing you're going to do is you're going to give your child the cup. Now, when you give them the cup, remind them to not flush the toilet or to wash their hands until after they have given you the sample back. This is really important because we're trying to make sure that the sample is not diluted. And sometimes people will try and use the faucet or the toilet to dilute a sample. And also, sometimes people will try and use just the sound of those things to sort of mask them rummaging around or doing something. So again, no washing their hands or flushing the toilet until after they've given you the sample. This is also why I recommend standing outside of the restroom while they are taking their test. Now, I'm not saying you have to be in the bathroom with them or keeping the door open, but just making sure you are staying close and outside of that restroom. So if there is something going on in there that sounds abnormal, that you can hear it. Now, once they get out and they hand you the sample, you are going to check for the results. Now, with a cup test like this, it usually comes like this, and then you would peel off the front, which would expose these testing strips. I always recommend trying to read results away from your child, so out of sight of your child. And that's for a few reasons that I will go into in a different video. But if you can, read the results somewhere else. Now, the other thing that you might notice on this cup is a temperature reading. So when looking at a drug screen, you're really hoping for the sample to be between 90 and 100 degrees. Now, not all drug screens are going to have a temperature reading. For example, if you're using one of these, it does not. That is okay. Really, what you want to be mindful of is when they hand you the sample, what you're looking for is for it to feel body temperature. It should not feel cold and it should not feel hot. Both of those would be more concerning. Now, when reading results, what you're looking for is for there to be 2 lines under every test strip. 2 lines means it is negative. And that means 2 lines regardless of how faint it is, even if it's barely there. 2 lines means it's negative. Now, if you have a test strip that either has no lines in it or it's missing that control line, that means that the test is not valid. That means that something went wrong with the testing strip and it's not accurate and you would need to retest. And that is it. That is the recommended steps on how to administer a drug test at home. 3 things to remember when testing at home. Be consistent with protocol, be random with tests, and be prepared for pushback. So what does that look like? Be consistent with protocol means that once you have a protocol that you're going to follow, and you can use the one from our walkthrough video, that you're doing that every time you are administering a drug screen. We really want to make sure that we're being clear with our teens and that we're giving consistent messaging. And when we do that, it actually lessens potential for pushback, and it can also lessen potential arguments in the future. So let me give you an example. Let's say you would ask your teen to take a drug screen, but you're pretty flexible on when they would take it. You don't really do things like checking pockets or anything like that. But then there is a week where they're seeming a little off. Maybe you do have concern that there has been some recent use. So this time when you ask for a drug screen, you are being a little bit more stern. You're saying, you know what, no, I need you to take it right now, or I want you to empty your pockets. What happens is that now the door's been open for your teen to give some pushback because they might feel thrown off and confused because for them, they're like, why are you switching things up? You never asked me to do that. So they might respond with certain things like, you don't trust me, you're accusing me, you're saying I used. And then you end up in this like power struggle with them, right? But if you are just following the steps that you always follow, then even if there is some suspicion of use, there's less of a chance that it's going to come across accusatory and turn into a fight because you're just following protocol. Now, number 2 is going to be, although we want to be consistent with the protocol, we want to be random with the tests. So the reality is things happen, but sometimes we end up getting in this habit of testing on the same days. And a lot of times that has to do with just practical reasons, like maybe scheduling, maybe because of your work or school, or because your teen spends time between 2 households. But the concern with that is that when we do things repetitively, we begin to be able to anticipate that. And that can actually be really risky for someone who is in early recovery. But when we keep things random, it can actually be really beneficial to the teen and also to you. So, for example, for the teen, it can be useful because if they're having, let's say, some dips in motivation, or they're having some of those using thoughts, which is actually really normal in early recovery, then having random testing can really help to keep themselves accountable because when they have those thoughts, they're able to remind themselves, I could get tested at any time, I could get caught, and then I'd have to deal with this consequence. It's not worth it. So they can kind of walk themselves back from taking that action. And for parents, it can be really useful because when you keep things random, your teen is not going to be able to anticipate when they're going to be tested. So that means it lessens the chance for them to be able to easily tamper with the tests. Now, it of course does not make it impossible, but it does make it a little bit more difficult if they can't think ahead and plan and anticipate when they're going to be tested. Now, number 3 is be prepared for pushback. So the chances are is that at some point when you ask your teen to take a test, they might respond with a reason as, why it's not a good time or why they can't do it right then. And you want to be prepared for how you're going to respond in those moments because regardless of what the reasons are, even if they're legitimate, you don't want to veer from being consistent with the protocol and being random with those tests. So let's say your teen says, well, I don't have to pee. I don't have to go to the bathroom. That might be true. But once we ask them to take that test, it's really important that we stay with them until they take that test. So a way that you as a parent might respond could be, I understand, I hear that. Let's go get you a glass of water. And then we can sit and watch TV until you do have to go. Or I'm just here in the kitchen, so why don't you sit at the table and you can work on some homework and let me know when you do have to go. So that's a way that we can be prepared in the moment on how to respond. Now, another thing that they might say could be something like, I have no problem doing it, but I'm going to be late for school or I have practice, so I can't do it right now. So the best way to limit that pushback is by not asking your teen to take a test unless you have flexibility with your time to sit with them until they can successfully take that test. So that's it. Those are the 3 things to remember when testing at home. Be consistent with protocol, be random with tests, and be prepared for pushback. Keep in mind that a positive test result on its own does not automatically indicate if your teen needs treatment or what level of care would be most appropriate for them. It's important to consult with a professional, such as a licensed therapist, a certified alcohol and drug counselor, or a treatment center. Here at Evolve, we offer a quick and free assessment with someone from our admissions department to help determine if your child could benefit from some professional support. Call today for more information or to set up your free assessment. Thank you so much for watching this video. I hope that it has been helpful. Be sure to check out the description below for a link to Evolve's full home drug testing guide and other helpful resources for parents. Until next time.